According to the Health Ministry, the number of contact tracers has been increased by nearly half, from some 330 to about 480 now since mid-July. And that's about the time Singapore saw a sudden surge of COVID-19 cases after the KTV cluster was announced on July the 12th. Well, earlier this month, Health Minister Ong Ye Kung said for a small number of cases, from the point of notification of a confirmed case, it had taken 14 days to issue a quarantine order to close contacts because of the difficulty in the tracing process. My colleague shares more on the process these days compared with the early stages of the pandemic.
There's two main phases that contact tracers need to go through. The first is what we call the activity mapping phase. Now, in this phase, in the past, contact tracers would call confirmed cases and ask for a detailed rundown of their activities and interactions. They'll also call, say, the patient's family and friends to verify any information or fill in any information gaps. Now, with Safe Entry and Trace Together, they still do what they did before, but they will also use the information from Safe Entry as a reference for interviews, so they can corroborate the patient's account with their Safe Entry data. Likewise, for the second phase, for identifying and contacting close contacts, in the past, they would have to identify and call them, get the police to help, maybe, comb the streets, look through CCTV footage, and conduct ground inquiries to track down individuals. They may also go door to door to find people. Now, with these additional tech tools, say the patient uses Trace Together, contact tracers will ask the patient to so-called trigger the download of data from the app or hand over the Trace Together token to MOH. Then, using a special computer system, they can access the patient's proximity data, and they can also retrieve the phone numbers of close contacts from the Trace Together system and contact them directly.